Hello, my name is Diana Cote. I'm a pediatric occupational therapist, and today I'm going to be talking about primitive reflexes. Primitive reflexes are involuntary muscle movement that comes from the brain stems. They develop in mom's utero and are essential during the first month of life survival. Typically, by the age of 1, all primitive reflex should be diminished or inhibited, as reflex has limited lifespan. As the primitive reflexes are inhibited, the newborn acquires new skill and heightened center of the brain to be mature and develop. What happens when the primitive reflexes persist? The persistence of the reflex can indicate damage to the brain or can indicate immaturity within the nervous system. Children with neurodevelopmental disorders like ADD, ADHD, sensory processing disorder, autism, and other learning disabilities typically have retained primitive reflexes that can contribute to their symptoms and affect learning and their behavior. Now let's talk about the motor reflex. The motor reflex is typically referred as the startle reflex. If your child becomes startled by the loud noises, sudden movement, or bright light, the baby will respond by extending their arms outward and bringing them in over the chest. The reflex is normally inhibited by 2 to 4 months of age. The motor reflex seems to be connected with each of the senses that are the foundation for the proper regulation. If the reflex is not inhibited, the child or the adult may overreact to the auditory stimulation or have an increase in other senses. The child will remain in flight or fight mode constantly, which leads to overreaction of the sympathetic nervous system. The increased demands in the adrenal glands may cause the child to become fatigued, and the child may have weakened immune system and suffer from allergies such as asthma and other chronic illnesses. Some of the symptoms that may present with a retained motor reflex are the following: motion sickness, poor balance and poor coordination, emotional immaturity, shy withdrawal, inhibiting to focus and easily distract, difficulty playing ball games, easily fatigued with activity or school work, allergies and decreased immunity, does not adapt well to the change in routine, and mood swings and anxious. Now let's talk about the asymmetrical tonic neck reflex or ATNR reflex. When the ATNR is performed, it's referred to as placing the child in the fencer position. The reflex should be diminished by 4 to 6 months. The reflex is inhibited by laying the baby on their back and turning their head to one side. The arm and leg on the side that is looking towards should extend, while the opposite arm flex. The ATNR develops in utero as well, and it is strengthened with the birth processes. Developmentally, the ATNR is very important for preparing the baby for movement like rolling from activities that require the child to cross midline in their body. Some of the symptoms that may affect them with the child with a retained ATNR include possible scoliosis, poor handwriting, difficulties with activity that crosses midline, difficulty reading and tracking, poor eye-hand coordination, and delayed crawling. Now let's talk about the symmetrical tonic neck reflex, which is the STNR. The STNR is also referred as the crawling reflex. The reflex presents briefly after birth and then appears again around 6 to 9 months and should be inhibited by 9 to 11 months. The child should be on both hands and knees as the head is brought towards the chest and the arms bend and the legs extend. As the head is brought back and extend, the arms straight out and the legs bend. The reflex helps to divide the body in half at the midline. When the STNR is still present, some of the symptoms are poor posture, slump while riding, poor eye-hand coordination, clumsiness, difficulty with synchronized movement like swimming, sitting in W shape, difficulty with eye focusing or near and far objects, attention affected cause of discomfort by sitting in one position. Let's talk about the Babinski reflex and the plantar reflex. The Babinski reflex occurs after the sole of the foot has been firmly struck. Then the big toe then move upward and toward to the top of the surface of the foot. The other toes fans out. The Babinski reflex is one of the normal reflexes in infants and in children up to 2 years old. Some of the causes that may lead to a present a Babinski reflex, it will be amyotropical lateral sclerosis, brain tumor or injury, meningitis, viral infection of the brain, multiple sclerosis, spinal cord injury, and stroke. Now let's talk about the plantar reflex. The plantar reflex allows tactile feedback into the sole of the foot, preparing it for state of readiness needed in preparation of walk. It will integrate between 4 to 9 months of age and is tested by a firm pressure of the ball of the foot and toes grabs in and go into the flexion. It may be difficult to put on shoes because of the toe crawl, gait and balance issue while standing or walking. An example, walking on tippy toes. One activity we can do to help integrate the ATNR reflex is to basically put our children in crawling position, and we're gonna ask them to crawl forward and turning their head to one side and then to the other. What we're gonna look here is that they cannot bend their elbows or flex their elbow. That's a sign of the ATNR that is not integrated. So I'm gonna do a demonstration. So we're gonna start in crawling position with straight arms, okay? And we're gonna ask the child to crawl and turn their head to one side and the other, okay? So one more time, crawling position, arms straight, and we're gonna ask them to crawl in a crawl straight, bending their head, turn their head to one side and on the other, okay? Without bending their elbows, no bending elbows, okay? That's for the ATNR reflex. One exercise that we can do for the STNR reflex is the yoga cards, the cat to cow exercise. We're gonna be demonstrating. What we're gonna be looking here is that we know, and we cannot, if we notice any weight shift towards the back or any uncoordinated movement, that's a symptom of the STNR not integrated, okay? So we're gonna ask the child to start in a 4 points position, no bending elbows, and we're gonna ask them to move their head up and down, up and down. This will be a normal movement. If we notice something like when we ask him to move the head up, they shift the weight to the back, that will be a symptom that the reflex is not integrated. This exercise is called the dog riding a bike, and is made to help integrate the motor reflex. We're gonna ask the child to stand up and walk like a dog with the foot upward in our position, and we're gonna ask to walk like this, backward and then forward. What we're gonna look in here is that the hands maintain straight while the legs are facing outward. If we notice something like this, when walking, hands like this, that's a sign of abnormal reflex, okay? And then for the plantar reflex and Babinski reflex, we're gonna ask the child, this is called the toy pickup exercise. We're gonna put a small toy in the floor, and we're gonna ask the child to pick up the toe with the toe, the toy with the toe, and the next finger like this. Another exercise for the plantar reflex will be sensory stimulation. For example, it could be done with a sensory ball with different texture that would stimulate the plantar reflex too.